confirmed number of new coronavirus cases reported in Los Angeles County over the last 24 hours is 22,688, with 37 additional deaths. Here in Torrance, 192 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Christine Lee. It's Wednesday, January 19th. More people in LA County are ending up in intensive care units as hospitals continue to struggle with staffing shortages. As of January 17th, both the 7-day average of new admissions of patients with COVID-19 and the total number of patients admitted into the ICU went up compared to the week before. New daily admissions increased by 9.5% to 644 patients, up 56 patients compared to the week of January 11th. 31% of COVID-19 confirmed patients were in the ICU and 27% required ventilation. Cases among healthcare workers are going up as well, from 973 to 1,268 between the end of last year to mid-January. Public health officials remind everyone that vaccines continue to provide the best protection against severe illness. They say unvaccinated people are 6 times more likely to end up in the ICU compared to those who are fully vaccinated without boosters, and 25 times more likely compared to those who are boosted. A new study is showing a 4th shot of the COVID-19 vaccine may be less effective on the Omicron variant. According to a preliminary study in Israel, while a 4th dose of the vaccine shows antibodies at higher levels than after the 3rd jab, it may not be enough to prevent Omicron infections. Israel's Sheba Medical Center is undergoing a trial among its staff to study the effects of getting a second Pfizer or Moderna booster shot. The results are compared with a control group that did not receive a 4th shot. The study's initial results raised questions about whether giving people the extra dose would prevent them from contracting the Omicron variant. While it may not prevent it, it could help people from getting seriously ill. Israel was the first country to roll out initial vaccinations against COVID-19 a year ago, and just last month started offering a 4th shot or second booster to the most vulnerable and those at high risk. The World Health Organization says there is a chance to end the COVID-19 emergency this year. Head of emergencies at the agency, Dr. Michael Ryan, spoke at a panel discussion on vaccine inequity. World leaders gathered for the annual World Economic Forum virtual Davos agenda. A number of topics were discussed, including climate change, meeting the challenges of vaccine inequity, and the role of technology. White House Chief Medical Advisor Dr. Anthony Fauci was among the many speakers to join a panel discussion along with Moderna CEO Stéphane Bancel, prime ministers of various countries, and health experts from around the world. Officials say while COVID-19 will never be eradicated, the public emergency could end by addressing vaccine inequities and fair access to health care. The World Health Organization officials have expressed concern in the past about the imbalance between socioeconomic classes, with fewer than 10% in lower-income countries having received even 1 dose of a COVID-19 vaccine. World leaders discussed their country's approach to ending the pandemic. The forum continues through Friday. Dr. Anthony Fauci believes it's too soon to tell whether the Omicron variant will bring an end to the pandemic. While at the virtual panel this week, he expanded on his thoughts on the future of COVID-19 when asked whether 2022 will be the year we enter into an endemic, meaning the virus will continue to circulate but at lower and more predictable levels. He was also asked if the Omicron variant might speed up the process given its high transmissibility. He said, "It's an open question as to whether or not Omicron is going to be the live virus vaccination that everyone is hoping for," and added that he would hope that would be the case. But he also said that would only be the case if we don't get another strain that dodges the immune response of the prior variant. In short, his answer is that there is no timeline for when COVID-19 will become an endemic. Dr. Fauci considered a pandemic to have phases, starting with the, quote, truly pandemic phase, followed by deceleration, control, and elimination. He said the ideal final step would be eradication, but mankind has only eradicated one disease so far, the smallpox. And he does not believe that this is going to happen with that virus. But we did see some hopeful news today. The total U.S. hospitalizations dipped for the first time since mid-December and is currently around 149,000 patients. COVID-19 deaths in the U.S. are climbing, and modelers forecast 50 to 300,000 more deaths by mid-March. That's when they believe the current wave will subside. The 7-day average of daily new COVID-19 deaths in America have been going up since mid-November, reaching close to 1,700 on January 17th. That's still below the peak of 3,300 deaths in January of last year. COVID-19 deaths among nursing home residents started rising again as well about 2 weeks ago, although still at a rate 10 times lower than last year, when vaccination was not yet available. Despite signs of the Omicron variant causing milder disease on average, health experts say the unprecedented level of infection means many vulnerable people will become severely ill. If the higher-end projections do become a reality, the U.S. could see a total of more than 1 million COVID-19 deaths by early spring. Morgues in some parts of the country are already starting to run out of space again. Johnson County in Kansas is one of them. Its health department director says they've had more than 30 deaths in the county this year, the vast majority of them unvaccinated. Overburdened hospitals could also contribute to more deaths. Medical experts say quality of care will suffer where there are extremely short staffing and patient overloads. The vast majority of COVID-19 deaths in the U.S. have been among seniors, especially those ages 85 and older. A recent analysis of data from the Centers for Disease Control and Prevention shows that there have been more than 200,000 coronavirus deaths among the 85 and up group, who represent 2% of Americans. Comparatively, there have been less than 400 COVID-19 deaths among the opposite age group, those younger than 5 years old. They represent 6% of the U.S. population. The numbers from the CDC show that less than 0.2% of COVID-19 deaths in the country have been among children of all ages, who make up 1 in 5 or 22% of all Americans. Since the start of the pandemic, about 1 in every 645 COVID-19 deaths and 1 in every 6 cases involved a child. That translates to a total of about 1,100 deaths and 8.3 million cases among children. Public health officials have been urging Americans to protect themselves during this Omicron surge by wearing higher quality masks. And last Friday, the CDC updated its mask guidance. While not recommending any one type of mask, the agency's new guidance emphasizes that N95s and similar high filtration respirators offer the best protection against COVID-19. With so many options available and even some scams, experts weigh in on the different options consumers have to choose from. Aaron Collins, a mechanical engineer with a background in aerosol science, says an N95 mask, when worn correctly, offers the best protection because it has a better face seal than KN95 or a KF94 mask. N95s are strapped to your head with a headband, which gives a snug fit, and with masks, a tight fit is key to better protection. N95s are made to U.S. government standards, put out by the National Institute for Occupational Safety and Health, and are rigorously tested. Some fakes do exist, however, so the CDC warns consumers to enter their mask information at cdc.gov/NIOSH-CEL. KN95s and KF94s attach with ear loops, which many people find more comfortable, but that don't seal as tightly to your face. Experts say it's a trade-off. Are you willing to give up a little bit of protection so that you can quickly take it on and off? KN95 is a Chinese respirator standard, but not strictly regulated by the Chinese government. While good versions do exist, low quality or fake ones do as well. The front of the KN95 should be stamped with both the company name and the respirator standard number. KF94 is a South Korean standard, and those respirators are regulated by the South Korean government. Collins tested multiple products and says every KF94 mask he tried was extremely high performing. When worn correctly, the masks with 95 on them should filter out around 95% or more of airborne particles, and the 94 option should filter around 94%. Experts say all of these respirators are a huge improvement in protection compared to a basic cloth mask. The Biden administration will make 400 million N95 masks available for free to U.S. residents starting next week. The White House announced that the masks will come from the government's Strategic National Stockpile, which has more than 750 million of the highly protective masks on hand. They will be available for pickup at pharmacies and community health centers across the country. This will be the largest distribution of free masks by the federal government to the public since the pandemic began. There will be a limit of 3 masks per person to ensure broad access for all Americans. Americans can also receive free COVID-19 tests. Residential households can order one set of 4 free tests to be delivered to their homes. The website is special.usps.com/testkits. There is a limit of 1 order per location, which includes 4 individual rapid antigen COVID-19 tests. They're expected to ship out starting late January. The free test kits are a part of President Biden's plan to distribute 1 billion rapid tests. Another government order is also in effect. This one makes private insurance companies cover the cost of the antigen coronavirus tests. The companies must reimburse people for buying up to 8 tests per month. This reimbursement only applies to tests purchased after the rule went into effect on January 15th. The tests must also be authorized for use by the U.S. Food and Drug Administration. To see a full list, go to fda.gov and search COVID test. With truckers as young as 18 years old will be able to drive across state lines to help ease the supply chain backlogs due to the pandemic. The federal government is moving forward with a plan to let the teens drive the big rigs from state to state in a test program. Currently, truckers going to a different state must be at least 21 years old, but an apprenticeship program required by Congress to help with backlogs would allow 18 to 20-year-olds to perform the same tasks. The pilot program was detailed last week in a proposed regulation from the Federal Motor Carrier Safety Administration and would screen the teens. Those with impairment violations or traffic tickets for causing a crash will not be able to participate. The American Trucking Association, a large industry trade group, supports the measure, saying the nation is short more than 80,000 drivers right now. El Camino College is trying to fill that void, especially at our heavily congested ports. It's offering a truck driver Class A commercial license course this winter and spring. Those who are interested can go to ecommunityed.com. A new date and location was revealed for the highly anticipated Grammy Awards. The 64th annual event, which was supposed to take place on January 31st in LA, was initially postponed due to the Omicron surge. Now the new date has been set to April 3rd, and organizers are moving the star-studded event to the MGM Grand Garden Arena in Las Vegas. The Recording Academy, which presents the show, says they're excited to take the event to Las Vegas for the first time. This is the 2nd consecutive year the Grammys had to be rescheduled due to the pandemic. Additional details regarding other high-profile Grammy-related events will be announced at a later date. This also creates a shift for other upcoming awards events, including the CMT Music Awards, which was originally scheduled for that same night. Officials say it has been moved to a later date. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. A group of El Camino College students are getting a one-of-a-kind opportunity to get their degrees while launching a startup business, all thanks to NASA. The young adults are part of the school's STEM program, and NASA awarded them with a $5,000 grant through its Minority University Research and Education Projects Innovation and Tech Transfer Idea Competition. In other words, they're very bright students who will continue pursuing their engineering degrees while designing a business that they pitched to NASA executives and potential investors earlier this month. The students say it's been difficult to juggle their time, but also well worth it. A lot of their core work got done during weekends, post-exam weeks, and even holidays. A total of 6 El Camino students participated in the competition and plan to open a 3D printing business that offers one of the fastest 3D printers of its kind and also have the accuracy and precision similar to a surgical robot. They were one of 8 finalists to present at a space tank virtual immersion experience at the NASA Johnson Space Center, kind of like Shark Tank. The El Camino team competed against top universities and are now teaming up with Virginia Tech University to gain entrepreneurial training as they continue to develop the startup. Congratulations on your big win and best of luck in creating your dream company. Now, if you have a great story, an upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as Bella Shaw brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.